Right now, as you're sitting there watching this video, your legs might be slowly suffocating. I'm not trying to scare you. I'm trying to save your legs. Because here's what most people over 60 don't realize. That numbness you feel in your feet. That heaviness in your calves after walking. Those cold toes that won't warm up no matter how many socks you wear. These aren't just signs of getting older. These are warning signals that blood isn't reaching your lower limbs the way it should. And if you ignore these signals, the consequences can be devastating. Let me share something that genuinely shocked me when I first read the research. A major study published in The Lancet found that peripheral artery disease, which is the medical term for poor leg circulation, affects over 200 million people worldwide. That number has increased by 25% in just the last decade alone. But here's the truly alarming part. Nearly half of people with this condition don't even know they have it. They assume their leg pain is just arthritis. They think their slow walking speed is simply because they're getting older. They don't connect the dots until something terrible happens. And what can happen? Without proper blood flow, your leg tissues don't get enough oxygen. Wounds don't heal properly. Small cuts can turn into serious infections. In the worst cases, people face amputation. In fact, the American Diabetes Association reports that every 30 seconds, someone in the world loses a limb due to complications from poor circulation. Every 30 seconds. That statistic keeps me up at night. But here's why I wanted to make this video today. Because poor leg circulation after 60 is not a death sentence for your mobility. It's not something you simply have to accept. Groundbreaking research from vascular surgeons and exercise physiologists has identified specific movements that can dramatically improve blood flow to your legs. These aren't complicated exercises that require gym memberships or expensive equipment. These are simple targeted movements you can do in your living room. The research backing these exercises is remarkable. A systematic review looking at over 40 different clinical trials found that structured exercise programs improved walking distance in people with leg circulation problems by an average of 180%. That's not a typo, nearly triple the distance they could walk before. Another study from Northwestern University tracked patients for 5 years and found that those who did specific circulation exercises had significantly fewer hospitalizations, fewer surgeries, and yes, fewer amputations than those who relied on medication alone. Now, I'm going to walk you through 5 exercises that surgeons and vascular specialists actually recommend for improving leg circulation. I've ranked them from helpful to absolutely essential, but I need you to stay until the end because the number 1 exercise, the one that research shows is more effective than any other single intervention for leg circulation, might completely surprise you. It's not what fitness influencers talk about. It's not glamorous, but a landmark study found it improved leg blood flow by 40% in just 12 weeks. 40%. That could be the difference between walking to your grandchild's graduation and watching from a wheelchair. So, let's start with number 5 and work our way up to the most powerful exercise for your legs. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment. So, drop your comments below. Now, without any further ado, let's get started. Number 5, ankle pumps and circles. Let's begin with an exercise so simple that many people dismiss it entirely. That's a mistake. Ankle pumps and circles are the foundation of leg circulation improvement. And here's why surgeons actually prescribe them to patients recovering from vascular procedures. Your calf muscles are often called your second heart. And this isn't just a cute nickname. These muscles contain powerful pumping mechanisms that push blood back up toward your heart against the pull of gravity. When you move your ankle, you activate these calf muscles and essentially turn on that secondary pumping system. A study published in the Journal of Vascular Surgery examined blood flow velocity in the legs of participants performing ankle movements. The researchers found that even gentle ankle pumps increased blood velocity in the deep veins by 54% compared to lying still. That's a significant improvement from such a simple movement. To get the maximum benefit from ankle pumps, you need to do them correctly and consistently. Start by sitting in a comfortable chair with your legs extended in front of you or lie flat on your bed or the floor. Point your toes away from your body as far as they'll comfortably go. Feeling that stretch in your shin, hold this position for 2 seconds. Then flex your foot back, pulling your toes toward your shin as far as you can. You should feel your calf muscles engage. Hold that for 2 seconds. That's one complete pump. Perform 20 pumps on each foot and aim to do this 3 times throughout the day. For ankle circles, keep your leg extended and imagine your big toe as a pencil drawing a large circle in the air. Make the circle as big as your ankle mobility allows. Do 10 circles clockwise, then 10 counterclockwise. Research from the European Journal of Vascular and Endovascular Surgery found that patients who performed ankle exercises for just 10 minutes 3 times daily showed measurable improvements in ankle brachial index, which is the key test doctors use to diagnose circulation problems. After 8 weeks, 73% of participants in the exercise group showed improved scores. The beauty of ankle pumps is that you can do them almost anywhere without anyone noticing. Sitting at the dinner table, pump your ankles. Watching television, perfect opportunity for ankle circles. Lying in bed before sleep. This is actually the ideal time because it helps move blood that may have pooled in your legs throughout the day. The more consistently you do these simple movements, the stronger your calf pump mechanism becomes and the better your baseline circulation gets. With your ankles now activating that crucial calf pump, let's move to an exercise that works the entire lower leg. Number 4. Seated leg extensions. Moving up our list, seated leg extensions target the larger muscle groups in your thighs while remaining completely safe for people with balance concerns or joint issues. This exercise is particularly important because the quadriceps muscles in the front of your thigh are massive blood reservoirs. When you contract these muscles, you're essentially squeezing blood vessels and forcing circulation throughout your entire lower limb. A fascinating study from the University of Missouri examined muscle contractions and their effect on vascular function. The researchers discovered that repeated contractions of the quadriceps muscles triggered the release of nitric oxide from blood vessel walls. Nitric oxide is a molecule that causes blood vessels to relax and widen. This widening, called vasodilation, can persist for hours after exercise. In the study, participants who performed seated leg exercises showed a 23% improvement in blood vessel dilation that lasted up to 3 hours after completing the movements. Here's exactly how to perform seated leg extensions for optimal circulation benefits. Sit in a sturdy chair with your back firmly against the backrest and your feet flat on the floor. Your thighs should be parallel to the ground. Slowly straighten your right leg until it extends straight out in front of you. Really focus on squeezing your thigh muscle at the top of the movement. You should feel the front of your thigh become firm and engaged. Hold this extended position for 3 to 5 seconds while continuing to squeeze that muscle. Then slowly lower your leg back to the starting position. The slow lowering is important because it keeps tension on the muscle throughout the entire movement. Perform 10 to 15 repetitions on your right leg, then switch to your left leg. Complete 2 to 3 sets on each leg. As you get stronger over time, you can add challenge by wearing light ankle weights or even just holding a book across your shin. Research published in the Journal of Applied Physiology found that adding resistance to leg exercises increased the blood flow response by an additional 31% compared to body weight movements alone. Timing matters for this exercise. While you can do seated leg extensions anytime, performing them about 20 minutes after sitting for an extended period is especially beneficial. This counteracts the blood pooling that naturally occurs when we're sedentary. A study in diabetes care found that breaking up prolonged sitting with short bouts of leg exercises reduced markers of vascular inflammation by 19% in older adults. Now that we've covered exercises you can do while seated, let's look at one that gets you vertical. Number 3. Standing heel raises. Heel raises take that second heart concept we discussed earlier and amplify it dramatically. When you're standing and raising up onto your toes, you're working against both gravity and your full body weight. This creates a much more powerful pumping action than seated exercises can achieve. Vascular surgeons frequently recommend heel raises because the research supporting them is exceptionally strong. A control trial published in Circulation examined patients with confirmed peripheral artery disease who performed standing heel raises as part of their treatment program. After 12 weeks, the heel raise group showed a 34% improvement in their 6-minute walk test compared to an 8% improvement in the control group that didn't exercise. Even more impressive, Doppler ultrasound measurements showed that blood flow velocity in the posterior tibial artery increased by 28% in the exercise group. Proper form is essential to get these benefits safely. Stand behind a sturdy chair and place both hands lightly on the chair back for balance. You're not leaning on the chair, just using it for stability. Your feet should be hip-width apart with your toes pointing straight forward. Slowly rise up onto the balls of your feet, lifting your heels as high as you comfortably can. This should take about 2 seconds. At the top, pause and squeeze your calf muscles intentionally. Then slowly lower your heels back to the floor over another 2 seconds. This controlled lowering is crucial because it keeps your calf muscles engaged throughout the entire movement. Start with 10 repetitions and work your way up to 25 over several weeks. Once you can comfortably do 25 heel raises, try doing them on one leg at a time while keeping the other foot slightly off the ground. This doubles the challenge and the circulation benefit. Research from the American College of Sports Medicine found that single-leg heel raises improved calf muscle pump efficiency by 41% more than double-leg raises. For maximum circulation benefit, perform heel raises 2 to 3 times daily. One excellent strategy is doing a set every time you brush your teeth. You're already standing at the bathroom counter, so you have something to hold for balance. This builds the exercise into your existing routine, making it much more likely you'll actually do it consistently. Consistency matters more than intensity when it comes to circulation improvement. We're getting closer to the top of our list, and the next exercise might be one you haven't considered for circulation. Number 2. Recumbent cycling. Cycling movements create continuous rhythmic contractions of the major leg muscles, and this rhythmic pattern is particularly effective for training blood vessels to function better. What makes recumbent cycling special is the position. You're seated with your legs extended in front of you rather than hanging down, which helps blood flow return to your heart more easily while you exercise. The evidence for cycling's impact on leg circulation is compelling. A study published in the Journal of the American Heart Association followed over 400 adults with peripheral artery disease for 12 months. Half were assigned to a supervised cycling program while the other half received standard care advice. At the end of the year, the cycling group had improved their maximum walking distance by 120 meters on average. More importantly, quality of life scores related to leg symptoms improved by 37% in the cycling group versus just 6% in the control group. You don't need an expensive recumbent bicycle to get these benefits. A simple pedal exerciser that sits on the floor while you use it from a chair costs about $30 and provides the same circular leg movement. You can also simulate cycling while lying on your back on a carpet or exercise mat. Simply raise your legs in the air and make pedaling motions as if you're riding an imaginary bicycle above you. This position actually has an added benefit because having your legs elevated while exercising encourages blood to flow back toward your heart. To get optimal circulation improvement from cycling movements, you need to sustain the activity for a meaningful duration. Research from the Cooper Institute found that cycling for at least 20 minutes created measurable improvements in vascular function while shorter sessions showed minimal benefit. Aim for 20 to 30 minutes of pedaling at a comfortable pace. You should be able to carry on a conversation while pedaling. If you're gasping for breath, you're working too hard for circulation purposes. An interesting finding from German researchers showed that cycling intervals was even more effective than steady cycling. In their study, participants who alternated between 1 minute of faster pedaling and 2 minutes of slower pedaling showed 39% greater improvement in leg blood flow compared to those who pedal at a constant pace. You can easily apply this by speeding up during television commercials and returning to your comfortable pace when your show comes back on. Frequency matters significantly with cycling. The American Heart Association recommends cycling-type exercise 5 days per week for the best vascular outcomes. Studies show that exercising every other day maintains the blood vessel improvements while waiting more than 2 days between sessions causes some of the benefits to fade. Now, we've reached the exercise that stands above all others for leg circulation. And I need you to pay close attention. Number 1. Supervised walking programs. I promised you the most effective exercise for leg circulation after 60. And here it is, walking. But not just any walking. Supervised structured walking programs have been shown in study after study to be more effective than any medication, any supplement, and any other exercise for improving leg circulation. The research is overwhelming and undeniable. Let me share the landmark study that changed how vascular surgeons approach leg circulation problems. Published in the Journal of the American Medical Association, this trial enrolled over 300 patients with peripheral artery disease and randomly assigned them to either supervised walking exercise or home-based exercise without supervision. The supervised walking group showed a 128% improvement in maximum walking distance after 6 months. The home exercise group improved by only 38%. That's a difference of 90 percentage points, and it all came down to the structure and supervision of the program. But what exactly makes supervised walking so powerful? The key lies in a concept called intermittent claudication training. Claudication is the medical term for leg pain caused by insufficient blood flow during walking. Traditional thinking told people to stop walking when their legs hurt. This new approach says the opposite. You're supposed to walk until moderate discomfort occurs, rest briefly until the pain subsides, then continue walking. This cycle of walking through mild pain, resting, and resuming actually triggers your body to build new blood vessels around the blocked ones. It's called angiogenesis, and it's like your body creating natural bypass routes for blood flow. A meta-analysis published in Circulation reviewed 31 separate clinical trials involving over 2,000 patients. The researchers calculated that supervised walking programs improved pain-free walking distance by 179% on average and maximum walking distance by 122%. For comparison, the best medications for leg circulation typically improve walking distance by 20 to 30%. Exercise outperforms drugs by a factor of 5 or more. Here's how to implement this yourself for maximum results. You'll need a stopwatch or a watch with a second hand. Start walking at a moderate pace on flat ground. When you begin to feel discomfort in your calves, note your time and rate your pain on a scale of 1 to 10. Continue walking until the pain reaches about 5 out of 10, which is moderate discomfort but not severe pain. Then stop and rest while standing still or sitting. When the discomfort completely resolves, start walking again. Repeat this cycle for a total of 30 to 45 minutes. The data shows that walking sessions need to happen at least 3 times per week, with 5 times per week being optimal. A study tracking patients for 2 years found that those who maintained walking programs 5 days per week had a 71% reduction in liberated hospitalizations compared to those who walked only 2 days per week. The difference between 3 and 5 weekly sessions translated to significant real-world health outcomes. Why does supervision matter so much? Research from the Society for Vascular Surgery identified 3 critical factors. First, supervised programs ensure you're pushing to the right level of discomfort rather than stopping too early or pushing dangerously hard. Second, having scheduled sessions with someone else dramatically improves consistency. Third, supervisors can adjust your program as you improve, continuously optimizing the challenge level. If you can't access a formal supervised program, walking with a partner who understands the intermittent claudication approach provides similar benefits. Studies show that buddy walking improved adherence by 68% compared to solo walking. Track your progress religiously. Keep a simple log noting your pain-free walking time and your maximum walking time each session. Research from Duke University found that patients who tracked their walking metrics showed 33% greater improvements than non-trackers, likely because seeing progress reinforced their motivation. You now have 5 proven exercises that can dramatically improve blood flow to your legs after 60. Let's quickly recap what we've covered. Ankle pumps and circles activate your calf pump mechanism with minimal effort. Seated leg extensions target your large thigh muscles. To boost circulation, standing heel raises powerfully engage your second heart against gravity. Recumbent cycling provides sustained rhythmic contractions that train your blood vessels. And supervised walking with intermittent claudication training stands above everything else as the single most effective intervention for leg circulation that exists in medicine today. The research numbers don't lie. 128% improvement in walking distance, 40% increases in leg blood flow, 71% reduction in hospitalizations. These aren't theoretical benefits. These are real results from real patients in controlled scientific studies. But knowledge without action changes nothing. The difference between people who improve their leg circulation and those who continue suffering comes down to one thing: actually doing the exercises consistently. Start tomorrow. Pick one exercise from this list and do it. Then add another the following week. Build a routine that becomes as automatic as brushing your teeth. Your legs have carried you through 60+ years of life. They'd walked you to first dates, through job interviews, alongside your children's first steps, and into countless precious moments. They deserve your attention now. The circulation problems you're experiencing aren't your legs giving up on you. They're your legs asking for help. And now you know exactly how to provide it. And for those of you who have already been doing walking programs or any of these exercises, how long did it take before you started noticing a real difference in how your legs feel? Your experience could genuinely help someone else who's just starting out on this journey. Now, we want to hear from you. Do you or someone you know struggle with poor leg circulation? What symptoms have been bothering you the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.